Good afternoon, Andrew Audrey. Let's begin the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
You can now start your OET roleplay.
Good afternoon, Mihiraa. It's good to see you. Could you please confirm the reason for today's visit?
Good afternoon, Andrew. Yes, have an appointment for shingles vaccination.
Thank you for the confirmation, Mihiraa. Before we proceed, do you have any concerns or questions?
Yes, I'm a bit hesitant about it, to be honest. I've heard a lot of conflicting things from friends and family, and I'm just not sure if it's necessary for me. I've managed my diabetes quite well for 20 years, and I've never had shingles before, so why do I need this vaccine now? I'm worried it might be a bit of a fuss for no reason.
I completely understand your hesitation, Mihiraa, and it's very wise of you to ask these questions. It's important to be fully informed before making a decision. The shingles vaccine, which is what we're discussing today, is designed to give you strong protection against the shingles virus. It works by significantly reducing your chance of developing shingles in the first place. And even if you were to get it after being vaccinated, the vaccine would help to reduce the severity and duration of the disease, making your recovery much quicker and less painful. Can you tell me what specifically you've heard that's made you reluctant? What are your main worries about it, Mihiraa?
Well, a friend of mine said she felt terrible after her last vaccine. Not for shingles, but some other one she had. She had a terrible headache and felt feverish for days. I just can't afford to be out of commission like that, especially with my diabetes to manage. I've heard the side effects can be quite bad, and I don't want to risk it if it's not absolutely necessary.
I can certainly appreciate your concern, especially if you've heard about someone having a bad experience. It's important for us to know about your personal history. Thinking back to other vaccines you've had in the past, such as the flu shot or others, Mihiraa, have you had any side effects or discomfort from them? How have you typically responded to vaccines in the past?
I've had the flu vaccine every year, and I've been okay for the most part. But I remember one year I felt quite unwell. I had a slightly raised temperature, a bit of a headache, and I felt really tired. I also didn't have much of an appetite for a day or two. It wasn't anything serious, but it was enough to make me wary of getting another one.
Mihiraa, thank you for sharing your past experience with the flu shot. It's completely understandable to be cautious, as your reaction to that vaccine is not at all uncommon. It's helpful for us to know how your body might react, so we can prepare you for what to expect. When it comes to the shingles vaccine, it's reassuring to know that any side effects you might experience are typically very mild and short-term. Most people report a bit of soreness, redness, or swelling at the injection site. Some might also feel a little run down, with a mild headache or some fatigue, similar to what you experienced. These effects usually don't last long, often disappearing within a day or two. If you do feel unwell, these minor after effects can be managed with simple solutions like taking over-the-counter pain relievers, such as paracetamol, and making sure you drink plenty of fluids to stay hydrated. It's crucial to also consider the other side of the coin, the possible consequences of not getting vaccinated. Shingles is much more than a simple rash. It can be an incredibly painful and debilitating disease. The rash itself is often accompanied by a burning or tingling sensation, and in some cases, it can lead to a condition called postherpetic neuralgia, which is a form of severe nerve pain that can last for months or even years after the rash has healed. The rash can also appear on the face, and if it spreads to the eye, it could potentially lead to vision loss. In rare but very serious cases, shingles can lead to other complications like pneumonia, septicemia, or meningitis. These are severe illnesses that we absolutely want to help you avoid. Given your age and health history, the shingles vaccine is a key step in protecting you from these serious health risks.
My goodness, I had no idea it could be that serious. I just thought it was a rash. The severe nerve pain sounds terrifying.
I'm glad we could talk about this, because it's a common misconception. Given your age and the fact that you've been living with type 2 diabetes for over 2 decades, you are more vulnerable to developing shingles and its serious complications. Mihiraa, as we get older, our immune system naturally weakens, and having a chronic condition like diabetes can further compromise our body's ability to fight off the virus. This is why the vaccine is so strongly recommended for people in your situation. It's an important step to protect yourself. Knowing all this now, and understanding the risks and benefits, do you feel comfortable proceeding with the vaccination today?
After hearing all that, I think it's probably best to go ahead with it. The risk of getting shingles and the severe nerve pain is just too much to ignore. I consent to having the vaccination.
That's an excellent decision, Mihiraa. We'll get that sorted for you right away. Mihiraa, thank you for taking the time to discuss this with me today. It was really valuable for us to talk through your concerns and to address your questions about the shingles vaccine. To summarize our conversation, we've confirmed that this vaccine offers strong protection against the shingles virus and helps to reduce the severity of the disease if you were to get it. We also discussed the possible side effects, such as soreness or fatigue, which are generally mild and can be managed with simple remedies like paracetamol. Most importantly, we've established that given your age and your diabetes, you are more vulnerable to the severe consequences of shingles, such as long-term nerve pain or even vision loss. I'm very glad we were able to clear up some of the misconceptions and that you now feel comfortable and informed enough to proceed with the vaccination today.